Welcome, everyone, to Pawsitive Veterinary Dentistry Podcast, the podcast dedicated to helping veterinary professionals elevate patient care through better dentistry, better diagnostics, and better decision-making. I'm your host, Benita Altier, licensed veterinary technician specialist in dentistry, and the founder of Pawsitive Dental Education. Whether you're in a general practice, specialty, academia, or still in training, this show is designed to give you practical, real-world insight you can take back to the dental table and use right away. Today's episode is entitled Dentistry on the Wildside, and this episode truly represents the intersection of advanced specialty training, global experience, and a deep professional responsibility. I'm really honored to welcome my dear friend, Loïc Legendre. He is not only a DVM, but also a diplomate of the American Veterinary Dental College, the European Veterinary Dental College, and has extensive knowledge in zoo and wildlife medicine with the AVDC. So really excited. We've been friends for 20 years, I think, somewhere around in there. He practices currently at West Coast Veterinary Dental Services in Vancouver, British Columbia, Canada, which is a specialty referral center, and works alongside another board-certified veterinary dentist, Dr. Angie Bebel, and he currently has 3 residents, which I guess one of them just passed her boards, but Heather, Claudia, and Caroline. He's deeply committed to teaching, and this is where we work together in rabbit and rodent labs, which is really exciting for me because you were my original mentor on that subject. His special areas of interest are orthodontics, maxillofacial reconstruction, and wildlife dentistry, which is our topic today. So welcome, Loïc.
Hi, welcome. Yes, thanks. Quite an introduction.
Yeah, so really excited to have you here. So now, before we get to the serious stuff, my last guest left you a question, and you will have the opportunity at the end to leave a question for the following guest. So during the recording today, just kind of think about a question you might want to ask someone like yourself, or it could be a VTS in dentistry like myself. And I've been super excited to hear your answer on this question because when we received this question with my last recording, I was thinking this was a perfect question for you because you have examined the mouths of probably more species than most of us will ever actually encounter. So the question is, what is the weirdest thing you have ever found during an oral exam inside the oral cavity of an animal that absolutely did not belong there?
And that actually is the same question that often get asked. What was your most weird or unusual wildlife case presentation? I was presented with a big tarantula with staples stuck in her mouth pulps.
Oh
And
my
what had
goodness.
happened is the tarantula was a pet for a school, and the tarantula spent the weekends with various students, and one of them obviously was a little so-and-so, and he decided to try to staple the tarantula. So on the Monday morning, the tarantula came back with staples stuck in the palps, and I was asked to go and remove them. And I said, well, it's not really the mouths, they're just palps. And they go, yeah, but you're close enough. So I ended up gently removing staples out of a tarantula. So that was definitely not belonging there, and that was definitely out of my comfort zone.
Oh my goodness, that is unusual for sure. And yeah, I think that's one thing that probably only you would have been able to handle, although we actually
I don't know about that. But yeah, it was like, okay, let's stay cool with this one.
Yeah. Oh my goodness. We actually place staples to close wounds and suture things, right? And we're used to
Right,
taking
except those were
staples
paper
out,
staples.
but not paper staples. Yeah, and especially not tarantulas. So, oh my
Yeah,
God, that's
two
really
don't go
awesome.
together.
Yeah, that was a brave child stapling the tarantula as well. So maybe he wants to be a veterinarian when he grows up.
Or delinquent, one of
Oh,
the two.
maybe. Yes. Hopefully he chooses the correct path because
Yes.
we to
Let's
have the
hope so.
veterinarian, not the delinquent. Oh my goodness, that's amazing. So, question, you've been working in a referral setting for a long time since you became boarded as a veterinary dentist. How does working in that kind of environment really shape how you approach a complex case? Because you're working with residents and you have a peer who is another boarded veterinary dentist. I know you have technicians and staff that are really amazing. I mean, how do you how do you think that really changes the way you approach some of these complex cases, knowing that you have such a accomplished staff to work with?
The staff, the setting, but also most of the time, by the time you see them, you're number 2 or number 3. They usually arrive to your door if it's a complex case with a desperate need for answers. So you're kind of the last stop before trouble. And so you've got A, to be prepared to deliver, but B, it gives you also a license to be more not aggressive, but more thorough, more adventurous, more fully rounded when you approach a case. Just because you don't want to leave any stone unturned, you want to make sure that everything's been done before it's been done correctly, so there is no false information. So you've got to recap what has been done, make sure that it's accurate, because sometimes you even get referral with the vet that refers telling you it's this tooth, and then when you look in the mouth, they've got the wrong number. And you go, okay, so now from that I can infer that this person doesn't know much, and most of the information that's been transcribed to me is probably wrong. So I've got to start back right at the beginning and see what's going on. Or you get information from somebody you know, and you can see that they're at the end of their depth, and so you have to be prepared to provide the next step. So that changes your approach, obviously, rather than being first line and going, you've got to come in with answers because that's what your clients want. The other thing is, most of those people, by the time they come and see you, they've gone to 1 or 2, and therefore they're aware of cost, and they decided that it's worth the cost, or they decided that the cost is not important, they want the patient fixed. So the pressure on you will not be a monetary pressure, it's a pressure to deliver. And if you tell them you can do it, you better make sure you actually can do what you say you do. Otherwise, you're going to be in trouble. So that changes the whole approach. For me, that's always been a good thing because I work well with a bit of pressure. And that kind of pressure forces me to do things better and faster. Some people don't work that way. And so that would not be the place for them to be. And I'm not at all implying that I'm better than anybody else. It's just my temperament fits well for those kind of situations where there is a bit of pressure. So that's probably why I ended up where I am, is that it fits me well.
Right.
Like for all of us, that's what happens. We end up tailoring our practice to fit what we're after.
Yeah. And just not being so, I guess, risk averse, you're definitely willing to take a chance and even try new techniques or new things to try to solve the problem, because we're going to talk about this. You're dealing with so many different species. It can't be easy, and you're not always going to have everything in your comfort zone. You're not even working in your actual clinic, where you're maybe out in the wild, or you're in a place where you don't have all the niceties and things that you normally have. And even having your team at your clinic, you may not have them somewhere else. So you have to be very, I suppose, resilient and adventurous, which I think you definitely are in that way. That's why it suits you so well. So yeah, that's great, right? I mean, I think I'm nailing your personality there a little bit on being adventurous and resilient.
Yeah, and that's exactly it. You put your finger on it, is the amount of comfort zone you require. People are happy doing the same thing repeatedly because there is a big comfort zone, so they barely have to be there. They don't even have to be awake. They can do it, and to them, that's perfect life. I have a comfort zone that's probably about that thick. So to me, repetitive, always the same, no room for creativity bores me.
Yeah.
Students always ask me, what discipline do you prefer? Like, do you like root canals? And I go, no, root canals are great. They're good part of the practice, but they're so regimented. They're step by step by step. There's no creativity. You have to follow rules. I would never make it in the army because too many rules to follow. Orthodontics or wildlife, it's new. It hasn't been done before. There is not necessarily just one path. There's more than one way to get there. And therefore, you've got to be thinking as you go. And that to me is a lot more fun.
Yeah.
That's what gets me up in the morning.
That's great.
So this is how I operate. So you're totally correct. It's the adventure, or we're back to the slight stress that there is in the background to force you to react. And that's what makes it work.
Yeah.
No doubt about it.
When things don't go perfectly well, I'm sure you feel comfortable just pivoting, which someone else might just wind up sort of crashing and burning at that point, not knowing what to do, but you've pivoted so many times, figuring out how to advance your surgery or do whatever it is that you're trying to do, that you push those boundaries, which I feel like really has made you stand out in a crowd in regards to being able to do things that most people wouldn't even attempt to try. And rabbit and rodent dentistry is one of those things. I get the pleasure of working with so many veterinary dentists, but they really want to leave the rabbit and rodent dentistry to you and maybe a handful of other people, just because that's just out of their comfort zone. It's not something that they love to do, but they may love doing endodontics or something else, right? And so it's good that not everybody likes doing exactly the same things, or they'd all want to do what you do, right?
Yes, that's true. Yeah. And in a way, it sometimes flabbergastes me, because to me, rabbits are simple. I mean, there's only a couple of presentations that are most common. Yeah, you might get something out of the norm once in a blue moon, but the presentation are very simple and the correction are very simple. Yes, you need to have a whole new set of tools and there is some skills to acquire, but they're not, you saw, we do the labs. It's stuff you can acquire in a day, or at least the basics of it. So it's not something that will take you 6 months practicing 2 hours a day to get to, like getting ready for the Olympics kind of thing.
Right.
You do a weekend course on rabbits and you should be fairly proficient to be able to deal with most of them. And so it is not a highly killed. It's just that people are scared of the whole package. Oh, it's a rabbit. It's going to die under anesthesia. And you go, get a better anesthetist, which is why my staff, as you said, you need your staff there because they're the one that keeps them alive. I'm busy doing the teeth, right? So everything works as a package, but you shouldn't be afraid of a label like, oh my God, it's a rabbit. You should look at it in detail and find out it's not that complicated. It's always a surprise to me that nobody else wants to do something and I'm still doing it. And I go, but it's not that complicated. Wow, you saw when we do the lab, it's always like, you can do this. And then they do it and they go, oh my God, it was not that complicated. Go, exactly. It's just a question of trying it.
Yeah, they've got to try it, right? And we don't often see those labs, but I know you and I usually do those labs at VMX every year and at the Veterinary Dental Forum. So, and may offer some labs up there in Canada as well. So I think that if someone is interested in doing some learning on rabbit and rodent dentistry, really searching out one of your labs would be a great place to start, because like you said, once they get in there and we start teaching them the basics and then they actually start doing it, I think they realize that the dentistry portion of it is not insurmountable. They definitely can do those skills, which we could do another podcast we talked about just regarding rabbit and rodent dentistry specifically and some of the instrumentation, because I think that's when people kind of get themselves in trouble, is not really realizing where their blind spots are when it comes to tackling some of these cases, which may be anesthetizing a patient, but not actually being prepared to tackle what they need to tackle. They don't have the right equipment. They don't have the right knowledge, expertise, and training to be able to actually address what they find once they get that patient anesthetized. And that can be a pretty serious situation because they now have put the pet under anesthesia, which can be one of the more risky parts because, as you said, often they're debilitated and pretty sick or having some pretty significant problems before someone notices that there is a problem and brings them to the veterinarian. And then they may bring them to a general practitioner who isn't trained to recognize that there's a problem. And then on top of that, not know that they could even refer to someone like yourself who has the skills, expertise, and equipment and all of the team and everything to actually tackle those kind of problems, right? So that can be a real disconnect between these animals needing help. So, just having all that experience on rabbits and rodents, and we're seeing more of those patients as pets. What do you think a general practitioner should be thinking about when it comes to seeing one of those types of animals in their practice? Just as the basic thing they should be looking for when it comes to dentistry and oral health for rabbits, rodents, or other animals too, like chinchillas, guinea pigs.
So good question. But before we start on that, we have to make one important differentiation. And you've heard me say it before too, because we go through that through the lab, is that rodents is a huge group. I mean, it's one of the biggest mammalian groups. There's over 2,000 species, and they go literally from a 12-gram shrew to a 60-something kilos capybara. So you've got a lot of variety there. And they have one thing in common, which gives them their name, rodent, from the Latin rodere, which means to gnaw, is that they've got big incisors that continue to grow. But on top of that, out of that 2,000 group, there is a smaller group within it, referred to as herbivorous or rodents or caviomorphs, which is probably 30 or 35 different species that all the teeth grow. So even though they're rodents, their dentition's closer to a rabbit than it is to a rodent. And unfortunately for us, out of that 30, 3 of them are patients, like chinchillas, guinea pigs, and degus have all their teeth grow. So if a person is dealing with those, like a general practitioner, the first thing you should remember is that they're not just dealing with incisors. And even though they might be presented because the client will tell them the incisors are long, those incisors are long secondary to elongation of cheek teeth. So the primary concern is not the incisors, it's the teeth in the back of the mouth. And therefore, if they want to deal with it, they've got to have the knowledge, the equipment, and be prepared to deal with those back teeth. If they do not have that, they should refer, because they're going to end up in serious trouble, as we know. So yes, the piece of knowledge here is that any of those 3 herbivorous rodents show to your clinic, and you're most likely dealing with back teeth problems. Like 98% of the time, that's what's going to be the reality of things. Therefore, if you want to be able to help them, you've got to have the equipment and the knowledge to deal with those back teeth. It's not just the incisors. If they come in, you train the incisors and say, oh, I've done my job, you've done absolutely nothing. Actually, you've done worse. You're a charlatan because you haven't even addressed the problem. So please refrain from doing that, because this is not helping. So yes, that's the first rule. You want to do rodents, have the knowledge to deal with the back teeth and the equipment. You're right, the equipment, we should do a course, like a lecture on that, because there is a whole bunch of equipment that's just for those guys. I've got multiple trays to work at with at my clinic. I've got 2 full trays that are just for rodents. You go wide 2, because some days I've got enough rodents and 1 tray is not enough, so I need 2. That's the reality of things. So there is a whole set of instrumentation that is dedicated to those guys. And if you don't have that, you should not be dealing with those patients.
And we call that ADD, right? Acquired dental disease. Is that right? That's what you would call that. Yeah. And it's often a husbandry issue when it's acquired, right? Where the owner needs to be consulted regarding how to feed the pet and all of that, which, we could definitely have an episode just to talk about that, because it's so important.
And then they want to deal with it under sedation, and that becomes another ADD that becomes anesthesia deficient dentistry.
Oh, that's not a good one for sure. We don't want
I know.
that.
There's a problem with ADDs. There's too many of them already. So you've got to qualify which one you're referring to.
Yes.
With acronyms.
So with just trimming incisors too, you can actually do more damage than good, depending on how someone approaches that.
Well, you end up with a rough open bite. So now they're not able to grasp the food, so they can't cut it. And therefore, they're even more likely to starve than they were before they came to see you. Now, the teeth regrow fairly fast, but still, they might not be able to eat well for a whole week. And on these little guys, when they need a quarter of their body weight every day, that's trouble. It doesn't take a week to get in trouble with a small rodent. So yes, if you're not addressing the things correctly, you can do harm. There's no doubt about it.
Yeah. And if they choose to cut the incisors inappropriately, they can cause longitudinal fractures of the teeth. Is that really something that people should understand as well? Like, if we're obviously going to talk about in another episode how dentistry happens in the back of the mouth, but if somebody's doing something inappropriate in the front of the mouth, they could also harm the animal.
So the other message here is, do not use clippers on teeth. They're kind of disappearing, but I'm sure if you look around, there's probably still some companies that sell clippers to clip incisors on rodents, and that is totally antiquated. borderline negligent as far as I'm concerned. As you mentioned, it can cause diagonal fractures that will expose the pulp, and then now you've got an endodontic infection on a tooth that's got no root, so you're in serious trouble because you can't even do a root canal.
Right.
So yeah, you're working your way towards losing a tooth with serious infection, possibly osteomyelitis, and the whole chain of problems that go with it. So don't cut teeth with clippers.
Yes, please do not do that. And, as veterinarians and veterinary professionals, our job is to not do harm. And so we really owe it to these animals to educate ourselves before we even consider anesthetizing them and getting in literally over our heads with trying to do some treatment thinking we're helping, which we might actually be causing serious harm, which could lead to their demise, especially if they can't eat, because these animals have to keep their gut moving, right? And they can't go without eating for very long periods of time. So yeah, good. Well, we'll have to do another episode on that type of dentistry, because I know that's really where you shine in the pet population. All the things that it's just invaluable knowledge. And I usually always go and attend your lectures, even though I've heard them several times over the years. But I just love listening to all the little pearls of wisdom and everything that you have to give the doctors and the technicians out there. So now I'll kind of switch gears, if that's cool with you. Let's truly go to the wild side. So we're going to talk about some of these wild animals that are not pets, they're not owned critters. They could be in zoos though. So, you have, I see, with the AVDC, a ZWD credential. Can you explain that in case there is a veterinarian out there thinking about becoming a diplomate and is really interested in zoo medicine?
Okay, so quick recap. Veterinary college for dentistry was just dentistry, and therefore whoever got a degree or a membership, diploma, could work on anything. Then a few years later, we had a sub-college, the equine group. So now people that graduated had to decide whether they were small animal or companion pets or equine. And then you can see what's happening is you've got now two groups, and then in the middle, the rest of the pets, the exotics, the wildlife just disappeared, because now you have a license for companion pets or for equine. So you say, well, what happens to the rest? And so a group of us started a certificate, and it's evolving. So we hope that in a few years it will be a fellowship. So it will be a full subspecialty to the college, the same way that now they have oral maxillofacial surgery and oral maxillofacial medicine subgroups. You're going to have a fellowship in wildlife or zoo and wildlife animals. So anything that does not fit as a rabbit, a guinea pig, a dog, a cat, or a horse. So the rest, from possums to shrews to elephants, tigers, sea lions, polar bears, you name it. All of those do have dental problems, and nobody is now qualified to look after them. So that's when we evolve the group. So the ZWD stands for Zoo and Wildlife Dentistry. And actually, that's part of getting, because if you're going to collect letters, anybody can get an A because it's for Americans. So any American college, you got your A, and then the D, of course, or the V is easy because that's veterinary. But a Z and a W, that takes a little bit more work. So that was the most fun of the whole thing, is to get those.
And it's such a great legacy, because when you think about what you're leaving to the world, taking care of these animals around the world, having that designation and really growing some experts in that particular discipline is going to really make a difference for animals worldwide. That is amazing. So. Yeah. That's amazing. I'm super thrilled to know you and that you did that, because it definitely, I think, is so necessary. So thank you for explaining that. If you are working in a zoo or with a wildlife species, you don't really have the luxury of just going about your day, coming in and drinking your coffee and thinking about what you're going to do with the patient. There's often kind of an event, right? If someone's going to be anesthetizing some wild animal, whether it's out in the wild, literally, or in a zoo, and it takes a whole coordinated team effort. Can you walk us a little bit through some of that planning process that goes into even deciding to anesthetize an animal, and how does this kind of work, and what kind of contingencies do you put in place in case things don't go as planned?
Yeah, so you're right. It becomes an event, and the doing part actually becomes the least in my mind, or not the least, the minor part. By far, the most important and challenging and stimulating is the whole planning. If you're going to do something that's going to weigh several hundred kilograms, you're going to have a whole team just to move it, and if we need to roll it, you need to have several people. So right there, you need manpower just to handle the beast. So we're not dealing with two of getting together to work on a patient. We're 20, and so that obviously takes a bit more planning. But also, you now have 19 people out of the 20 relying on you being able to do what you're supposed to do because they're doing their part. And so when it gets to your part, you've got to be ready to do it. And the planning. So what does it entail? Well, it varies from patient to patient. So that's the thing. It's not two of them are the same. The other thing is also very easy. Who are you working with? If it's somebody where you've done work before, we already kind of know what the other one is capable of, what the other one expects. It's like a marriage. The more you know, the better things run, right?
Yes.
So it's all those elements that are going to just shape the whole procedure. But by far, to me, is the planning. And you say, well, what do you do when plan A does not work? Well, I usually don't show up to one of those unless I've got A, B, C, and D. I want to have three alternate to the one I want to do, just because having just one other alternate might not be enough. And like I say, you're here, the thing is down, they've never put it down before, there's 30 people there, there's a crane to lift it because it's 5 tons. You can't just say, oh, well, I'm sorry, but I'm out of ideas. I'll see you again. I'll go home and think about it, and I'll see you again in 2 weeks. That's not going to happen. So all that thinking process got to be done before you show up, which means that you don't sleep as well. It's just all the stuff that goes with it. But that's the fun part too, because you literally have to, first thing you do is get out of the box. And I was told that I'm probably quite lucky actually, because the first big wild patient I had was an Indian elephant.
Oh, wow.
Like right off the bat, like I get the phone call and they say, hey, would you like to work on this? And I go, okay. They say, well, it's not something you've done before. And I go, well, I've done big animals. And they say, no, this one's about 4 tons. I go, oh. They say, and it's an Indian elephant. I go, okay. So get out the phone call. I go, okay, oh my God, what am I going to do? So I've Peter Emily, who happened to be, our godfather at the time, and related to him the case. So he said, grab a piece of paper and a pen, and he started to give me plan A, plan B, plan C, plan D. Okay. And then he said, oh, one last thing. I go, yes. He goes, be prepared to improvise. Ha 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 ha, clunk. I go, but that was right. That's exactly what you have to do, is you've got to be prepared to improvise. So that's the best piece of advice I ever got is you've got to really come in with everything firing, because things might add up a different way, and you've got to be able to say, okay, well, now I'm not getting 2 and 2 4, I'm getting 2 and 2 22. So where do I go with that? And how can I change it? So it's always a work in progress, and you don't stop thinking while you're working on it. And that's to me is the challenge.
Being an adrenaline junkie, right?
Possibly.
Yeah. So how did it go with that elephant, since you told us that was your first time?
Well, okay, so the dental plan worked. The preliminary diagnosis I had in my mind was correct, so I acted on that. There was exposed pulp, but because it's a vital pulp and it's a tooth that's always growing, we decided to do a vital pulpotomy. So clean the pulp and then cover it up. Now, the execution was somewhat out there because it had never been done. So at the time I was using a product by Fuji LC, which is a glass ionomer, and you have to mix 2 drops of the liquid with 1 little scoop of powder. So I took 30 scoops and 60 drops and started to mix it with a buttering knife, just to mix it well.
Like
and
your
then
frosting?
Flop to push it in and covers the whole thing. And it did work. The part that was not planned is that the animal was just sedated. So she was kind of swinging a bit, and I'm working right under her, and I'm the right size, so I had my shoulder right against her shoulder also, and I had my head right under her, so I could work into the tusk just like this. Well, I left to go and wash my hands because we were done. We go, everything went well, and we hear thump. Walk back in the room, and she's just passed out. So she fell, but there was nobody under her.
Good.
So that was good. So
Oh,
it all
yeah.
worked okay. She
Well,
woke up
good.
fine.
Good.
But
Good.
that
Yeah.
was the first one.
Yeah, well, that's scary. And I've done equine medicine a lot, and you definitely don't want a horse falling on you, let alone an elephant like that. So,
Yeah, my anesthesiologist broke a leg like that.
oh,
Literally, the horse
really?
fell on her.
Oh,
So
yeah, these things can happen. I don't think people realize how much risk people put themselves in physically just working with some of these animals that could really hurt you, whether it's intentional or not. If they fall or something happens, you could actually even lose your life.
like wake up during the procedure.
Exactly. Well, that's
I've had that
exciting.
once.
Oh,
I've had that
gosh.
one once.
What kind of animal was that?
I was a brown bear. Well, actually, black, but it was brown in color. So North American is like a brown, the North American black bear. But he was starting to react when I was working on his teeth, and I could see that his paw was moving a little bit. So I told the anesthetist, and he said, no, I'm watching, everything's fine. I said, no, it's not. I'm right beside him, and I can tell you. So he said, fine, I'll come and sit on him. So he sat on the bear's shoulder, so he's watching down on me because I'm on the floor working in the mouth. And then while he's talking to me, all of a sudden he goes, whoa, and he goes, he moved. I go, I told you he's awake. And so I'm out of here. I say, it's yours now. Luckily, he had an IV line ready, so he pushed some more drugs in, and we were okay. But there was a few minutes there where it was somewhat tense.
Yeah, just a little bit. And, you might be right in the middle of a really technical part of your procedure, and you can't be having animals even move, let alone jump up and try to leave. I'm sure the bear would try to get away before they would attack, probably, but you never know, right?
But you never know. Exactly. Yeah. In the process of getting away, you might be in the way, and then life is not so good.
No.
Touch wood, never got hurt. So
yeah. Well, goodness. Yeah, that sounds very hairy, but definitely I'm glad that it worked out okay. You were able to keep the patient.
So am I.
Yeah. Oh my goodness. That's crazy. Any other really interesting cases that you feel were changing the way that you decided to do this planning? Because I'm sure every case that you've done, you've learned from the planning process whether you were really prepared to handle this particular situation or not. Is there any case that really changed the way that you plan to do these types of procedures on exotic animals?
No, I think I've been lucky because I would say probably 95% of the time plan A has worked. Only a few times have I gone to go to plan B, and I don't think I've ever had to go down to C or D kind of thing. So most of the time, I guess the plan worked well. And before you say, oh, well, this is great, you must be doing well. It's not me. It's just the fact that the whole team, we had everything planned correctly. The anesthesia went well. The animal dropped where we wanted it, so it's always a team approach, not just one person. So I would say most of my stuff has worked well because I've been lucky to work with a very good anesthesiologist. His name is Martin Olena. He works at the Vancouver Aquarium. I think he's the one that's responsible for one of the chapters on anesthesia on one of the recent books on wildlife medicine. So he knows his stuff. And so having the peace of mind that I don't have to worry about that because I know he knows what he's doing allows me to just concentrate on my part. And hopefully he feels the same with me, saying, well, I can do my anesthesia. I know Loïc can do the dentistry. So we get along A, well, B, we get things done because both ends of the contract get fulfilled. I do my part, he does his part, and the team can do the job. So it's always make sure that whoever you work with also is up to snuff.
Yeah.
So pick your partners carefully.
Yes, it's like marriage, a match in heaven there, where you guys are getting so used to working with each other, and you can depend on the other person has their part, and that they have the team around them that they also trust, right? So that hopefully you can just focus on the dentistry part of things, which I would think would be the absolute most important part of this whole thing, because I'm sure they're doing
I
other
know
things,
about that.
the other things they're doing to the animal as well, right? Because they might
Yeah.
be doing all sorts of wellness checks and different things that they're
Yeah,
doing on the
sometimes there's more
animal.
than one. We've done some where there's 3 or 4 of us. I've done work on animals where they're also doing ophthalmic surgery and gastric exam. So we have an endoscope. We've got an ophthalmologist there to do eye surgery. I'm doing the dental, and then Marty's doing the anesthesia. So there's 4 of us, like 4 different boards working on the animal, one after the other or together, depending on how much space we've got.
Right. Yeah, because it's just, you don't want to be putting these animals down very frequently, and you got to kind of maximize the potential of that anesthetic to actually sleuth out too if there's anything else that we didn't even know about is wrong with this animal, so that we can hopefully help them while we've got them down, right?
Yeah, and the good places like the well-run zoos and so on, they will usually try to organize those things when they do the annual checkup. So they drop the animal for checkup. So they're going to take blood, they're going to do X-rays, they're going to do endoscopy, they're going to have a dental exam, an eye exam. So that's the way to do it, because you maximize your return for one anesthetic. The ones that wait till there is a visible problem to call you, usually not the good places to go to.
Right.
And sometimes you don't have a choice. Unfortunately, you can't pick that. And there's been a few cases where I've gone to places and go, this is just not, not good. And so now I'm part of it. So I'm going to make sure that at least my part goes well, because this is not up to snuff.
Yeah. Have you ever that you didn't want to actually be a part of anesthetizing a specific animal given the conditions that you were met with when you arrived?
Not when you arrive, but I've had a couple where they call me, they send me everything they've got, and then after discussion go, listen, I don't think you're on the right track. So me doing this is not going to help, because there is this and that are not working as well. So yeah, so not at the time when I'm there. I haven't had that experience where you back out at the last minute, but sometime in the planning process, you find out that it's just not going to fly.
Yeah.
So yes, you will have those eventualities, those situations where you go, and I don't want to be part of this.
Yeah.
That has happened. Yeah. Not often. Most of the time, the people that you work with are dedicated and know this stuff. So the bad ones are rare, but they do exist like any other profession. You have some people that are at the wrong place at the wrong time, should not be there.
Right. And I'm sure it probably comes from asking the right questions during the planning process to sleuth out what it is that you'd be up against once you get to the location where the animal's at, and knowing your other team members and doing all the collaboration and planning ahead of time to make sure that when you do arrive, you can go ahead and execute the plan. And whether it's plan A, B, C, or D, you still have the things that you need to make it happen. Right?
Yeah, totally correct. So to deal with those, my approach is be cognizant, be well versed in the basic principles that would apply across the boards, and make sure all of those are fulfilled. Once you've got that, then you just have to work on the specific detail applying to that animal, like size, on the tooth, like the specific thing that's going to possibly modify your approach. Your basic principles should be are very similar from one species to another, and those you should make sure that they are fulfilled, or they are present, or they are working like they're going to be okay before you go any further. Because each of them, as you say, are different, but sometimes it's just a question of size. I mean, take cats; they all have the same teeth, but the size of the tiger teeth are different than your pussycat. But they're the same. So you know the anatomy, you just have to modify technique for size. Get to bears, same thing, similar teeth, different size, slightly different because you have that are meat eaters, you have more omnivores. So some teeth are changed a bit, but very similar. But then you get to things like cetaceans or macropods, where all the teeth grow at the back and move forward, or all the teeth are the same. And you go, okay, so now what do I do with that? So there are things you've got to know your basic anatomy and your basic principle before you go any further. If you don't have that knowledge, and yeah, you're going to get in trouble. So you say, well, how come you got there? I started with biology. I didn't go through agronomy or any of those things that some people, a lot of veterinary students start with. None of that. I went into biology, and then I went specifically into mammalogy. So I did study in comparative mammalogy. So what makes different mammals different. So I had already a good idea of what some mammals do, and therefore what kind of apparatus they have to do what they're doing, as opposed to some others that do something different. And that includes the teeth. If you look behind you, you see that cabinet's got about 70 different skulls, and you can look at the teeth and go, okay, this guy eats this. Look at his teeth. Just that tells you. So that helps a lot because you already have a good idea of what you're getting into, and that's your basic knowledge. And then you have to find the detail, like on this specific patient that you're going to see, where are the infraorbital foramen and the mental foramen, so you can do blocks. Are they accessible? What do they look like? So then you have to get the detail on each of them so you can prepare yourself further to be able to work on that mouse when you get there. So it's a step process. You've got to get the basic first, obviously, and then work your way towards the details. Like you say, it's a thinking process. Like you've got to work your way to be ready to deal with that patient when you finally see it.
Yeah,
but
that's really a couple of questions I have for you. One is, have you ever had to create instruments to use because you needed something that's going to fit that specific species? Have you had to fabricate your own instrumentation to deal with some dentistry cases, or have you been able to kind of modify something that already exists somehow?
Yes, several times. There is a very knowledgeable man in South Africa. He's not part of the college because he never went that route. But if you want to know about dental problems in African wildlife, he's the person to talk to, and his name is Hard Steenkamp. And I've had the honor and the pleasure to work with him. And we ended up putting together a weekend course, and the title was Wildlife Dentistry. And while we were putting it together, we decided that the first few slides that we would put on the screen would be with planning and preparation, because that's how the process starts. But the first 3 slides were actually photos of hardware store walls with all the instruments or all the tools, and say, okay, so now the patient's going to be X. Tell us which things you see on this wall that could be useful to do the work you want to do. In other words, start thinking outside of the box. So yes, we've used weird stuff like axle pullers, so you can rotate the tooth on a big tooth to loosen it up. So a chain wrench to grab it the same way. An electric hammer, so you can hammer without having to swing because there's no room to swing. Chisels, wood chisel, curved wood chisels, because they can work as good luxators, but they are wider in circumference, so you can go around the tusk on the walrus, which are about, this diameter. So all of those things, you've got to plan those things. Gerhard actually has a kit, so I didn't have to reinvent it, but he said anytime you want to use it, you're welcome to. A specific drill bits that he made or designed, he went to a machine shop to drill out tusk out of elephants, because he probably has done more elephants in this world than anybody else that I know. I think he's a premier person. If you want to talk elephant tusk, you got to go and talk to him. So he's got a set to kit, and he said, don't reinvent it. You have an elephant that needs it, call me. I'll ship the stuff FedEx, ship it back after. We're done. You've got to invent stuff. There's no doubt about it. There's nothing out there that's going to work. So that's the first thing you do, is when you plan how you're going to get that, you say, okay, what kind of tools have I got? Do they fit? No, they're too small. So I need something that's similar but bigger. Where can I find this? And that's where you go to the hardware store.
That's great. But that's what you have to do. And that's what Peter Emily said. You're needing to improvise, right?
Yeah.
So
ready last time I showed up at the walrus, I had drill bits, wood bits for bigger diameter. I had the big chisels. I had all of that in my pack.
They were like, are you the dentist? Are you here to work on the building?
Both.
Oh my goodness. Well, yeah, I imagined this, and I hadn't heard you tell me this before, but I just imagined that's probably what you had to do. So that's super interesting to know, and definitely cool, because you got to figure it out and get all that gathered, and even more things that potentially could work, because you may be traveling to a location with the things that you need, right? You're not bringing these patients into your hospital at home. So you've got to be overly prepared, I would assume.
Yeah, and that's exactly it. The walrus, it was fairly recent, so I remember exactly the detail. And half of the stuff I brought, I didn't need. I did not be
Okay.
using, but I just wanted to have it, just in case the stuff I did use did not work. So that was the next line of defense. So you will over prepare on those things for sure.
Yeah, and you probably know what's worked in the past too, so that you for sure have that thing, and then you have some other things that may work in addition, and maybe even have a second item of that just in case the first one breaks, right? So your favorite tool isn't going to be the only one that you have of that tool, right? It's kind of like that Crossley luxator when we do the rabbit and rodent dentistry. Everyone breaks those, and we can't really have enough of them. And definitely that instrument's one of those things that people have to do that particular task, right? Yeah.
It's like the parachute. You want to have a second one just in case the first one doesn't open.
Yes.
Otherwise, it's splat, which is not a good sound.
No, we don't want splat. No splat. What do you think is the most interesting animal that you ever worked on that was a wild animal?
I would say the most challenging.
Okay.
So the most challenging for preps for me was actually a beluga whale, just because it's an aquatic. It's not something you see often. Because it's aquatic, it's got a very spongious, soft bone in its jaw, and this one had a broken jaw. So all your challenges are altered to a point where you go, now I have to wear different shoes or a different hat to just be able to save this one. And then when you get there, you're on a platform on top of a swimming pool, so you're in water, which normally you're not. So you've got all that logistics that's changed. So it really makes your day exciting, but also exhausting because you're thinking really fast. Other challenge that's logistic is we ended up dropping a 5-ton, 32-year-old bull elephant, African elephant. So a big guy, 32 years old, they're solid. With tusks that are, like a meter long. They don't even fit on the screen. With a damaged tusk. And it was out in the bush. Like it's in a conservancy, but there's no fence, no nothing. So the anesthesiologist came in with a gun, darted him, and then we wait for it to drop. Then he goes in, gets an ear vein, and then we go from there. And we're in the bush. And of course, the anesthesiologist said, well, the last 5 I've done, they all fell on the correct side. So the tusk you want to work on is on the upper side. Well, we looked at him and go, why did you say that? Because sure enough, he just went, and the one we're working on is on the underside now. Why? Go, it's 5 ton and it's asleep and we don't have a crane and there's 5 of us. So you go, well, we're not flipping him over. So how do you get there? So we had to dig a hole so we could go under the elephant. So the first thing we did for the first 20 minutes is to dig a hole with 2 shovels so we could make a pass under, and so we could work under the elephant and access that tusk. So that was the first thing. And then it started to rain. You go, great. So now we're in the mud. And so we had to put awning a tent. Then we started, okay, so now what do we? It just kept on going like that. So things that you don't plan, but you have to deal with as you go, that just add up to the whole. So those are definitively the one that stand out because you had added difficulties one after the other, not insurmountable. We did the job. So you say, what next happened? Well, there was a crack in the tusk because they were all planned to remove that tusk. And I was excited because that's one I've never done. I've removed tusk on walruses, but never done an elephant tusk. And it's a job on its own. And Gerhard showed me photos and he's totally covered in blood when he's finished, which is not the photo you want to see, but you can relate to that. Go, yeah, I'd really like to try that one just to add to my resume kind of thing, but also for the fun. So I'm all set for that. And then find out that after examining it, it's a periodontal pocket. It's not, there is a crack, but it's not the cracks that's causing the problem. He's got a periodontal infection.
Okay.
So we put the probe and Gerhard is stuck under because he went down into the hole and I'm holding the lip from the top. And he goes, it's 14, the pocket. And, reflex, because you're so used to do dogs and cats. I go, millimeters? Well, that's not much. He said, no, you idiot, centimeters. It was 14 centimeter deep pocket. So, like this is a pocket in an elephant, which makes sense. But
it makes total sense.
Don't think about it until you go, oh, yeah, centimeters, not millimeters. Whoa. So we cleaned all that and we had to make tools because you go, do you have a curette for elephants? Nope. So
I have one of those teaching instruments that I always say is an elephant curette, but it's just meant to show people what
yeah,
they
the one, well, actually we had that one. So
Yeah.
we used something like that. Yeah, I know the
Okay.
one you mean. Yeah, the teaching one. Yeah, it's
Yeah,
perfect. It works like a charm.
it's a
So
good shape,
uh,
but it's not really sharp. You have to sharpen it up, I think.
But then the funny part is, well, funny, we're just chatting, well, like, conversing. He goes, so what do we do next? And go, well, it's a pocket. You root planed it. We should put antibiotics in it. He goes, really? I go, well, I've done that before. He goes, you've done one of those before? I go, yeah, actually, this one I have done. He says, well, I've done a lot of tasks, but I've never done one of those. He said, what kind of antibiotics? But I said, well, da 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 da. He said, well, I didn't bring this. I go, oh. He said, but there is a large animal vet down the road. So he phoned him,
Okay.
said, do you have any mastitis tubes, like antibiotics in mastitis tube? The guy says, yes. He said, okay, can you bring some? So we waited for the guy to show up, and then we filled up the pocket with that, and we put a gauze as a pack to roll the stuff in, and then we walk up the elephant, and that was the end of that story. So this one, the mud, falling on the wrong side, digging a hole, starting to rain, not being what we had planned, not having the right stuff, but then we fixed everything as we went. So that's a fun part of it. That's why it sticks out. You go, that was interesting.
You live
We
to tell
managed.
the tale. You live to tell the tale and face death potentially, right? But that's what life's about, right? And it's honestly like such a memorable occasion because things didn't go as planned.
Face death, no. I mean, probably could have flown quite well. And the flying is always good. It's a landing that hurts. Because during the procedure, so he was lying on his left. So I had my feet on the left tusk and I was bending over to pull on the lip. So I was folded over the right tusk, and the right tusk was right under my rib cage. So you can see the distance went from my feet to my rib cage. That's the distance between his two tusks, which is like over a meter wide of tusk, like in width between the two tusks. So I'm there and I'm pulling on the lip so he can get into the pocket better with a big spatula. And I'm there and I go, okay, if this elephant wakes up and moves, I'm flying because I'm stuck on his tusk to start with.
Yeah.
And as I say, the flying's great. It's always the
The
landing I was
landing.
concerned about.
Well, I'm glad you didn't fly, so you didn't have to land, and that all went well. And I'm sure that's the case when you're out in the wild like that. You just don't know what you're going to be up against with the weather, other animals that might be milling around out there, and having all the people and things that you need in one place. That's super exciting.
It's always interesting that way.
Well, my goodness. Well, an hour goes by so quickly when we're talking. In closing, is there anything specific that you'd like to have the listeners know in regards to wildlife dentistry, or even just touching on what we might see in companion animals with the rabbits and the rodents?
Yes, if you're going to do some of that work, just ask a lot of questions before you show up. And if you're not sure, just phone other people. You're not by yourself. Just reach out. Most of us will gladly help you. It's a question of getting as much information as you can before you show up to that patient. So be as prepared as you can be, which I know makes sense, but some people sometimes aren't. They're just happy to show up and then find out that they're totally unprepared.
Yeah, well, just from your stories, it just shows and highlights how important it is that if you're going to work on a species that you're unfamiliar with, that it just is all in that planning part. To be prepared before we actually even consider anesthetizing an animal and going down the path of treatment. And I know you've always been such a willing and great resource for people, and we'll link your hospital in the show notes. You work on referral basis only for seeing patients there, but certainly if anyone's willing to contact you to get at least some sort of direction where they can go to learn more, I'm sure that would be super helpful to the DVMs out there in general practice settings, or thinking about working with patients that they're not as familiar with. Thank you so much for that. Just the last part, did you think of a question that you'd like to ask one of your peers or someone like me, like what we ask you about finding weird things in animals' mouths?
Oh, that was the question.
That was your question. You have to think of a question for someone else.
I thought that was just your first question. That was an easy question.
I knew you could answer that one. And there's so many weird things we found in animals' mouths. You could probably come up with a lot of different answers, but a staple tarantula, that's a new one I've never heard you say, or never heard of that happening. So.
No, this one was good. Yeah, like, that's interesting. Well, I didn't realize that was a question. Yeah, it was well directed for what I do, for sure. That's a good question. Well, perhaps something more, what do you call it? Deeper, perhaps. Yeah, slightly serious, but not really.
Okay.
I take it too seriously. But looking at comparative work, so we are all organisms. We supposedly have been evolving for quite a while. So let's set up the premises. The Earth is billions of years old, as far as we can tell, and we mammals, the first mammal appeared 220 million years ago, and we've been evolving. You've had a lot of species that have come and gone. Us Homo sapiens have shown up only in the last 300,000 years. What do you think is going to happen? Are we going to go extinct soon or not?
Okay.
That's a tough question, I know. But...
Well, and there may not be an answer that we know for sure, but this person may have
we'll
an
find out,
opinion.
but we probably won't be there. I
Yes.
hope so. If we're there, go down.
What could lead to the extent of humankind as we know it today, right? Yeah. Well, thank you for that. I really appreciate that. And, it's just been such a pleasure knowing you. I feel like I've been so blessed to be able to learn from you and be able to participate in trainings that you've done to help others learn more about, especially rabbit and rodent dentistry. But the vast knowledge that you have and your experience really comes from your initial education, as you said, how you were so interested in understanding all species and all iterations of that to better understand what your job might be like if you became a veterinarian, let alone a veterinary dentist. So thank you for that.
You're welcome. But I think it's important is to make sure you pick your partners or helpers or colleagues well. Because when we do the lab together, I always tell them, if I'm just showing you how to do it, but if you want to do it better, faster, and cost less money when you're doing it, just ask Benita. She'll be able to tell you.
Well, as a technician, my job is to make you look absolutely amazing, but honestly, just to be your partner and to help really shine a light on how efficiency is so important, especially with these types of patients, because they're often small or compromised, especially when we're dealing with animals that may have debilitating dental disease. And it's just so important that your technical team is well versed on how to make that go, right? Because then you can focus on what you're really focused on, which is treating the teeth or doing surgery and things that is your expertise. So thank you for that. I appreciate you picking me to help you with some of these labs and things, because it's always my pleasure to work with you. We'll have to definitely do another episode again for sure, because we have more to talk about. But today's episode, we really tried to expand our perspective when it comes to dentistry and animals, because it's not just a Labrador or a rabbit. It could be a lion or an elephant. So really exciting to think about some of these other animals that we don't often think about. And we learned how excellence in dentistry really begins with planning and some education. We want to share with you some resources on how to learn more about wildlife and dentistry. I will share those in the notes. You can connect with me on my Instagram, LinkedIn, Facebook, TikTok, wherever you've listened to podcasts. Also, I have a YouTube channel, so you can watch this video on YouTube if you haven't done that. For now, keep learning, planning, and keep practicing positive dentistry. Thank you for joining me today on the Pawsitive Veterinary Dentistry Podcast.